Abby Normal, and I'm with the Joint Commission. We're setting up a scenario for your learning education and your benefit. This scenario starts with a patient who is going to be having pre-op surgery. The first scenario will be our bad nurses, what they're doing incorrectly. Just watch and learn.
Oh, hey, she looks just like my cousin. I'm gonna take her picture.
Okay. I don't think you should be doing that.
Oh, it's okay.
Hey.
Hello. Hey.
Scared me.
I have your pre-op medication.
Oh, okay. What is this for?
Oh, I don't know. The doctor just wants you to take it.
Do you have any questions? Yeah, I'm really nervous about this surgery. I was wondering if you could answer some questions or if I could actually talk to the doctor.
Well, I could probably answer them for you.
Oh, I know. He's really busy. I don't think he can come see you.
Oh, okay. Well, I'm just wondering about the scar that it might leave and how big the incision is going to be.
I think they're just going to be little bitty incisions. I wouldn't worry about it.
You think or you know? I'm really concerned about this.
I'm pretty sure they're just little. I wouldn't worry about it.
Have you ever seen the surgery?
No, but I just wouldn't worry about it. It'll be all right.
I'm really nervous.
Do you want some tissue?
Please.
All right, let me get you some. No, all they have at the nurse's station is these napkins. Sorry.
I might be able to see my husband before I go.
Sure you can. Do you need to use the restroom?
Not right now, but probably in a little while I will.
Okay, we'll come back in just a little bit.
Okay,
Okay.
thanks.
In this scenario, these nurses did quite a few things wrong. Let's start from the beginning. First of all, when they entered the room, they did not knock. They did not consider the patient's respect. By introducing themselves, they should have come over first knocking, gently waking the patient. Sometimes we wake them by rubbing the bottom of their feet so they're not so startled or that they react by hitting. They should introduce themselves. They did not introduce themselves. They did the steps of pre-op out of order. They did not identify the patient. They did not identify with looking at the wristband, asking her who she is, the date of birth. They did not check for allergies. Where was the consent form? There was quite a few other things wrong, as well as the medications were given, bed rails were still down, bed in the highest position. Does she have a call light? What about the drink? Did she drink this coffee? This could compromise the surgery for the day. The call light was also left out of reach, as well as many other things, from HIPAA violations to taking pictures of the patient without consent. We'll see how these things are supposed to be done correctly. In this next scenario, when we have two nurses that show us what a good nurse is like.
Miss Flowers?
Yes.
Good morning. How are you doing today?
Good. How are you?
I'm doing great, thank you. My name is Angie, and this is Jane. And we will be the nurses taking care of you before you go to surgery.
Okay.
All right. Here's your chart. Okay. I have your consent form here. So it looks like you've already signed it. Could you tell me once again why you're here and what procedure we're doing?
I'm getting my gallbladder out.
Okay. Are there any questions that you have for us?
No questions. The surgeon went over it. I am a little anxious.
Okay. We do have some medicine that we'll give you here in just a couple minutes.
Okay.
Do you feel like you need to use the restroom before we start?
No,
Giving your
I
medicine?
don't.
Okay. And this coffee, is this your husband's? I saw that he stepped out a few minutes. Is this his, or were you drinking coffee this morning?
Oh, this is his.
Okay. Do you mind if I go ahead and take it with me just to make sure it's not tempting for you?
Sure, that's
Okay.
fine.
We'll put it out at the nurse's station, and then when he comes back, then I'll hand it off to him.
Okay,
Okay.
thank you.
I'll give you your meds. Can I ask your full name and date of birth?
Claire Flowers, April 13th, 1989.
Okay. Here's your medicine.
And this will help me not be so nervous.
This will reduce the anxiety.
Thank you.
Okay. That's about it for right now. We'll let that medicine give some time to kick in. You sure you don't have any other questions for us?
Will I be able to see my husband again before I go
Uh-huh.
back?
Well, I'll go outside and I'll check to see him, and then I'll tell him that you were looking for him.
Okay, thank
All
you
right.
guys so much.
Okay. Let's make sure. Do you want to check to make sure that that's...
It's in the lowest position. I did check it.
Okay.
Just don't see her call anymore.
And then here's your call light. So that way, if you need anything before your husband gets in here, you can just let us know.
Okay,
All
thank
right.
you.
See you in a few minutes.
In the last scenario, the nurses were infringing on non-maleficence, as well as multiple HIPAA violations. In this scenario that we just saw, the nurses showed us the proper way to care for a patient preoperatively. Not only did they identify the patient and the reason she was here and made sure she understood these things, the consent forms were signed. No questions were left unanswered for the patient. There were multiple things done correctly. The bed rails were up, the bed was in the lowest position. They made sure that the call light was in the patient's reach. In this way, I hope you've learned how a good nurse is able to give proper care for preoperative surgeries. Thank you for watching.